is, everybody? I love math. I love math. Get into it. It's time for our math. It's Math Lovers Association. Right now, we're having our meeting. If you love math, then welcome to our Dosage Calculations Math Clinic. This is a 3-day event right here at Remar Review. If it's your first time joining me, hello, my name is Professor Regina. And I am excited about this opportunity to break into the subject that people say, I struggle with this. You can hear me, right? Okay. People say, I struggle with math. Oh, I'm not going to be a nurse because I can't do math. But let me tell you something. There are many nurses who maybe math is not their favorite subject, but you do what you have to do. And so tonight we will be doing our dosage calculations. Now, here are just some housekeeping rules. Okay, here's some housekeeping rules. The first one is this. Are we good? Let me just make sure. The first one is this. We will be working from this workbook. Okay, so get out your workbooks. Okay, we can hear you, but there's an echo. Oh my goodness. All right, let me just make sure that we're all good. Now let me know. Give me an okay if there's good, because you know we work together around these parts. I want to make sure that I want to make sure that we're all good with our everything. Okay. Okay, everybody okay? All right. So we're going to be working out of the workbook, okay? If you didn't get this email, please check your promotions tab in your email inbox, because it may not come to the inbox. It may have went to your promotions tab, not spam, promotions. All right. So we're going to be going inside of the nursing school V2. Now, if you are in nursing school, but you want to get ahead and you do not want to fall behind, let me tell you, the nursing school V2 is prepped with the fundamental subjects, right? The pharmacology introduction, and we will be doing right from the clinical math section tonight. So this is the solution that I created for nursing students. You know, primarily I do NCLEX prep, but this is my solution for nursing students who want to stay in nursing school and do well in nursing school. Okay, so get out your workbooks. We're turning to tonight, we are doing rounding guidelines. And if you know why rounding guidelines are so important, is because you are never going to get to the correct answer if you have not rounded the numbers correctly. And this is something that we miss in our nursing classes or our prerequisites in math. So we're going to go over that medical nursing rounding for tonight. We are also going to be looking at assignment and delegation, because assignment and delegation is a critical part of your nursing curriculum, and you cannot prioritize if you don't know assignment and delegation. Okay, so we have some good stuff here planned for you. If it's your first time, you're going to love it. All right, so we're going to open up our workbooks. Also, just for a reminder, tomorrow class is going to start at, you have your workbook. Tomorrow class is also going to start at 8 p.m. We're going to be doing liquid dosage calculations. And then Wednesday is a game night over the things that we have learned. So tap in, pencils, papers, everything ready. Dosage calculation workshop is what we are going to do. How can you get the workbook? It's super simple. If you haven't signed up for this workshop, let me just tell you really quickly where you can go. Go to remarnurse.com/clinic. Okay, remarnurse.com/clinic. Somebody put that in the comments for me. Okay, and then you'll get the workbook in about 10 minutes. So if you sign up now, you'll get the workbook in about 10 minutes. You can print it out. Okay, all right. I also want to, while we are here, just really quickly, this is the first night. I just want to offer up a prayer so that we can clear our minds, get ready to tackle this tough subject, and also not have any distractions on us, okay? Because we are sacrificing to be here. That means I know you're serious about studying, being a great nurse. So as part of my custom, we pray to get through this night, okay? So let's just say a quick prayer. Father God, we thank you for this day. We thank you for this opportunity. I just ask that as we cover math, that you bring into remembrance all the principles that will help us be successful, and you help us to recall this information when the time is right. We thank you for all that you do for us, and we ask these things in the name of your Son, our Savior, our risen Lord, Jesus Christ. Amen. Amen. Okay. All right. So let us get into it. And again, this is in the Nursing School V2. So you can just follow me right there if you have it. If not, you're going to get a preview of that tonight. So here we go. All right. And we're going to go down to the clinical math section. And there are several videos in the clinical math section. We will be doing some of them tonight. And then prayerfully, you guys will be in it studying on your own later on. So rounding guidelines is right here. And click the play button. Okay, time to take notes. Welcome to today's pharmacology class. We're going to talk about something really important when it comes to dosage calculations, rounding guidelines. This might sound like simple math, but rounding the right way is critical because even small mistakes can make big differences for your patient. So let's get started. What is rounding? Rounding is how we adjust numbers to make them safe and practical to use in real life. In nursing, we round to make sure medication dosages are accurate. Imagine if your math answer was 0.736 milliliters of medication. How would you even measure that? Rounding makes the dose something that you can actually give as a nurse. So here are general rounding rules. Let's go over the basics for rounding decimals, tablets, liquid medications, and weight. Okay, write these down in your notes. For decimal places, the rules are numbers less than 5, round down. Numbers 5 or greater, round up. Now, for example, if we're rounding to the nearest 10th place and you have 0.73, because the 3 is less than 5, we need to round what? Up or down? We need to round down, which would make our answer 0.7. But if we had the number 0.76, because that 6 is greater than 5 and we're rounding to the 10th place, we need to round what? Up. So our number becomes 0.8. Now, let's talk about tablets. The rules are always round to the nearest half tablet because you can't cut a tablet smaller than that safely. For example, we have the number 1.4 tablets and we had to round it. What would we round it to? We would round it to 1.5 tablets. Or if we had the number 1.3 tablets, how would we round that? We would round down to 1 tablet. Okay, let's talk liquid medications. The rules are round to 1 decimal place for syringes or smaller doses. If we have the number 1.46 and we needed to round to 1 decimal place, we would round the number to 1.5. Or if we had the number 1.42, we needed to round, we would round down to 1.4. Let's talk weight calculations. The rules are round the weight to 2 decimal places when converting pounds to kilograms or vice versa. For example, 154.32 pounds would be 70.10 or 10 kilograms. Now, let's work through a few more practice questions before we leave. Here's question number 1. A patient needs 2.765 milliliters of a medication. How should the nurse round it? So I'm going to pause it because I want you to try to work it out, okay? I want you to try to work it out. So I'm going to put it back on. I'm going to pause it. I want to see the comments on the screen, okay? I want to see the comments on the screen. So you have here a patient needs 2.765 milliliters of a medication. How are we going to round it? What are we going to do? How are we going to take care of it? Okay, I see the answers. Give y'all time to work this one out. And all right, it looks like we're on one accord here. Okay, let's look at the tenths place, the first decimal place. And then the number right next to that in the hundredths place is a 6. So do we round up or do we round down? We're going to round up. So the answer would be 2.8 milliliters. Question number 2. A patient needs 1.23 tablets of ibuprofen. Can the nurse give that amount? No, right? So what is the correct amount to administer? Okay, I'm pausing it here. What is the correct amount to administer? And you have to be careful here. I want to see the answer on the screen. Okay, and it is very important when we're doing nursing math that we look at 2 things. We look at, we look at what we're being offered, what's prescribed, and we also want to look at the units of measurements. Okay, the units of measurements. And for those of you who typically study NCLEX with me, tonight we are working from the nursing school V2. Okay, so if you're looking for this in the NCLEX review, we have moved over. We're in the nursing school V2 for the next 3 nights. All right. So yes, be careful because I saw some people putting milliliters here, and we're not talking about milliliters here. Okay. I'm going to play the video again. Write that down. We're talking about tablets. So remember, we round to the nearest half tablet. So since 1.23 is closer to 1 tablet, we need to round down. The answer is 1 tablet. All right. Question number 3. A patient weighs 154.75 pounds. How many kilograms is that? Okay, new calculation there. We're talking about 154.75 pounds. Go ahead and do that math for me. Okay, let's see if you're right. Let's see if you're right here. Remember the rounding rules. Remember the rounding rules. We're going to use the formula. And we are going to divide that weight by 2.2. And then we're going to actually round to 2 decimal places. So that answer is 70.34 kilograms. Question number 4. The nurse calculates a dose of medication to be 0.726 milliliters. How would you round it? Okay, new problem presentation. And this one should look familiar to you. Go ahead and put that one on the screen. Great job. Great job for everybody who got that 70.34. What about this one for milliliters? What about this one? Okay. And I love this. This is what I love. This is what I love about having these videos where you have them at home. You can stop them, you can pause them and actually do the work. So people ask me all the time, do I have do I do private tutoring? No, I've created something better. I've created this. Okay. All right, I'm gonna play it now.
All right, let's look at that hundredths place. And remember, we are only rounding to one place after the decimal. So I'm looking at that hundredths place and I see the number 2. Is that higher than 5 or less than 5? That is less than 5. So we are going to round down and the answer should be 0.7. All right, remember, always double check your work. Rounding is simple, but mistakes can happen if you rush. Practice, 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 okay? And I promise it will get easier. That's it for our rounding guidelines. I'll see you at the next lesson.
Okay, so the challenge here, and this was a very quick video because it doesn't take long to explain some of these principles. Like you don't have to sit through an hour-long class in order to get the principles for tablets, liquid medications, and weight. Now, what I just noticed just from this small section is that there are nursing students who don't know when you are appropriately to look at 2 decimal places or 1 decimal place. And I'll tell you, if you don't have the right decimal places, your answer will be wrong and your math calculation will be wrong. So this is something that you absolutely have to spend time doing. Now, in our workbook, there are more practice questions that I want to go over with you just so we can make sure we're firming this up. So we're going to actually go into just our presentation after it, okay? So we are going to go to additional notes. This is additional notes. So I want to make sure that we also get a review of 0 rules, when we're supposed to be using the 0 and when we're not supposed to be using these zeros. So we always place a leading 0 before the decimal. We always place a leading 0 before the decimal. And this is the workbook. It looks like the nursing school workbook, but it says the math calculations. Okay. We always place a leading 0 before decimal places because imagine, we're on page 6 right now. Imagine if that leading 0 was not there. So if we didn't have a leading 0 and it just said 0.5, and somebody gave 5 milliliters of a medication instead of 0.5, that is 10 times the dose that patient was supposed to get. So we have to remember to do this, especially in our documentation. Okay, very, very important. So we always place the leading 0 for doses less than 1. Subsequently, our number 2 point is we don't use trailing zeros. We don't use trailing zeros. Yes, you got it. Because again, if we put a 0 behind a number, we can also give 10 times that dose of a medication. So 1.0 milliliters, never. Always just 1. Okay. All right, let's talk about the drip rates. Let's talk about drip rates. So when we talk about drip rates, when we talk about IV dosage calculations, liquid calculations, it is very important that we are using the whole numbers. We're using the whole numbers, and you will absolutely get into drip rates when you get into that nursing school clinical section, because that's one of the things you have to master. Whether you're an RN or a PN, you need to know drip rates. So we round IV infusions always to the nearest whole number unless we are using a pump that allows for decimal, okay, that allows for decimal places. So show me here. If I give you this example, 24.7 milliliters per hour, what would you round that up to? Okay, what would you round that up to? And why is this so important to know? Because in nursing school, you have to do these calculations and you need to know the difference. And let me show you this. Let me go down here really quickly. I just want to show you the difference in how the nuances work. And I'm glad I see the correct answer already. So you have it. But did you know that there are different calculations for this? Let me make this, let me just do this. So tomorrow we're doing liquid calculations. How you treat liquid calculations is different from injectable calculations, right? And when we're talking about liquids, the way you treat liquids in an electric pump is very different than how you treat liquids on a manual pump. So this is what makes math so tough, is that we usually get right into doing problems without reviewing the rules. Okay. All right, so here we go. I asked the question, if we're talking about IV drip rates and we have 24.7, how are we going to calculate that? And Alicia got it. Okay. Adama got it. Lourdes, almost, I think you read it wrong a little bit. Look at that again. Natisha got it. All right. We are going to round up to the nearest whole number. Great job. Okay. Now let's talk about insulin doses. Who knows the rules for when we're working with insulin and the rounding rules for working with insulin? Have you ever been asked that before? It's something that's important to know. So for insulin, how about this? Insulin doses are never rounded. We never round insulin. So if 7.5 units of insulin are to be administered, then what? Okay. How much are we supposed to administer? If 7.5 is prescribed, how much do we give? We are going to go ahead and give that 7.5. That's a perfect trick question that I see often. I see it all the time. So we're always using that exact number. Nice. Great job. Okay. And that's because when it comes to insulin syringes, guess what? Those syringes are made for an exact measurement. So you don't have to round it to anything. Okay. So now I think you guys are ready to do some practice questions. I have even more practice questions so that by the end of it, we feel comfortable. We call it done as far as it is to be studied. All right, so practice question number 1. Okay, let's do these. Let's try to do these pretty quickly. A nurse calculates a dose. All right, this is math clinic time. A nurse calculates a dose of 0.755 milliliters. How should this be rounded? And remember our rounding rules. When we talk about milliliters, how are we going to round this? Or can we give it like this? Is this appropriate for us to give? Or are we rounding it? What is the decimal places that we round to? Okay. I see some progress. I see some improvement from the first question. You got it. Good job. Be so careful. Okay. If you don't get this right, please go back to the beginning of the video and watch the work that we did. Because I'm assuming the people who are not getting it right just came in late, and that's okay. So the correct answer here is going to be 0.8 milliliters. We are rounding to the 10th place only. So be careful. All right, let me write this down in my workbook. We did it. Okay, next question is this, number 2. A nurse needs to administer 3.149 of a medication. What is the rounded dose that nurse needs to give? What do you say? And look, how many people, after all, you're enjoying this? This isn't as painful as you imagined it to be. That's because we're easing our way into it. All right, correct answer. Oh, be careful. Correct answer here is 3.1. 3.1. All right. we are going to keep that decimal place here. We're going to keep that decimal place. I see some people rounded it to the whole number. This is not that time to do that. Okay. So 3.1 would be the correct answer. Be careful. All right. Let me write that down. Next question is this. A patient requires 2.25 tablets of a medication. How many tablets should the nurse administer? This is a tricky one, but I think you can do it. I'm confident that you can do it. Okay. Here we go. Correct answer. Oh, I see some varying answers here. I see some varying answers here. Remember to use the rules. The correct answer is 2 tablets. 2 tablets is the safe dose. Remember, we are rounding to the nearest half tablet. Nearest half tablet here. So 2.3 tablets, can't give that. Okay. And 2.5 tablets would be too much. So 2. Good job. How about this one? A child requires 5.78 milliliters of acetaminophen. The average syringe only measures in 0.5 milliliters. How much should the nurse give? Ooh. How much should the nurse give here? Wait. Have some people that are very quick. Math is your specialty. You're so fast with these calculations. I have to read it twice and make sure I have an understanding. Good job. I see the answers already. Very good. Very effective today, everyone. And remember where we're looking for our answers. Whenever we do class, I do classes on Mondays at noon, and I do classes Eastern time. Monday at noon Eastern time, I'm here every Monday. And then Wednesday at 9 p.m., I'm here every Wednesday. And one of the things that I teach is that you need to always look for your answer, not in the answer options, but in that actual question. And so if you're looking in the question, the answer is there. The correct answer is 6 milliliters. Now, so many people here have put 5.5 or 5.8. Why is that not possible in the scenario? Because right in the question, it tells you that you can only do 0.5 milliliters. Okay. So if you look at just 5.7, you're going to round that up. You're going to round that up. All right. Good job. Good job. I'm moving on. All right. Here's question number 5 here. A medication label states administer 1.75 milliliters for every 10 kilograms of weight. The patient weighs 88 pounds. How much medication should be administered? Okay. How much medication should be administered? Ooh. There's some steps here, right? There's some steps here. So what do we have to do first? Because we're given a formula. And if you can just identify the formula here, it's okay. If you can just identify the formula, you are already ahead. Okay. So what do we have to do first? What do we have to do first? Okay. Sure. The first thing we're going to do is we have to get rid of pounds because our formula is not for pounds, it's for kilograms. Yes, Stella, we have to convert this first. So we're going to convert 88 pounds into kilograms. Somebody like to tell me how to do that? Let's see if somebody puts the formula on here. We got to get rid of that 88 pounds and turn it to kilograms. I thought I saw the formula somewhere. Here we go. 88 divided by 2.2. Because we know that 1 kilogram equals 2.2 pounds. Okay. Is everybody following me at least there? Did we at least remember that conversion? That's a very important conversion. So I know I have nursing students from all over, from all different points. This is one you have to know. How many pounds to a kilogram? Great job. Okay. So I have some people actually doing it out for me. Okay. All right. So let me see if I have it here. We're going to do, this is what we have to do. So these are the steps. The first thing we are going to do, is convert that 88, okay, 88 pounds to kilograms. That gives us 40. So we're there. Now we can actually do the formula because it says to administer 1.75 milliliters for every 10 kilograms of weight. So we could do 40 divided by 10, and that gives us 4. And that's how we would multiply 1.75 times 4. Okay? All right. And then that gives us 7. So how much medication are we given? 7. 7. And listen, this is a concept that actually, once you master it, you can do any question that NCLEX gives you. You can do any question that ATI gives you. You can do any question that HESI gives you. Your exit exams, you will be able to do this. And if you're in clinical math, you will be able to do it. The secret to doing this type of math is isolating these principles one by one and not trying to do all of them at one time. All right, you understand that? And that's what we're doing here. So these classes won't be long because we will just be isolating these things. Now, people are asking for more questions. We actually do have a few more questions here. The pre-test that I asked you to do. Okay, and I don't know if you didn't get the workbook, you didn't do the pre-test, that's okay. But when you get the workbook tonight, then go ahead and do the pre-test for tomorrow. So we're going to do the pre-test now. It's a couple questions. This one here, how did you get 40? Great question, Sandra. Let's address it. How did we get 40? The reason why we got 40 is because we had to convert the 88 pounds to kilograms, because the formula that we're given says 1.7 milliliters for every kilogram. But they didn't give us the kilogram, they gave us the pounds. So it's a conversion, okay? It's a conversion factor. So we did 88 divided by 2.2, and that equals 40. You see that step? Okay. Oh, and then where did you get 4? 4 is the extension of 40, because we had 40 kilograms, but we're only looking at every 10. And so 40 divided by 10 is 4. Okay? Okay. That's how we got the 4 there. 40 divided by 10. Yeah. Okay. Good job. Good job, everybody. Now, I want to do the pre-test questions. Here. And let's go back up to the pre-test questions. All right, here's pre-test question number 1. And if you did them, you get to see now how you did. Okay, you get to see now how you did if you did the pre-test. So a nurse needs to administer 1.768 milliliters of a medication. How should the dose be rounded for safe administration? And this one is easy because I actually gave you the choices. Okay. So is it 1, 2, 3, or 4? What are we going to do? 1, 2, 3, or 4? And honestly, these are the questions that you want to get on NCLEX. The math questions like this, you're going to be like, yes, I love it. I know this. Okay. All right. So I should see everybody picking the same thing now. This is something that we covered already. So correct answer here is number 1. Yes, 1.8 milliliters is what we're going for here. Good job. Here's pre-test question number 2. This was the tricky one, but I think you'll get it this time. A patient requires 2.25, tablets of a medication. How many tablets can we safely administer? To the nearest half tablet. So we did this one during our lecture. Okay, we did this one during our lecture. What do we have? Again, good job here. Correct answer is 2 tablets. Very good. You're hearing, you're listening, you're learning. Next question. This is the last pretest question, and it's this. A patient weighs 178.45 pounds. How many kilograms is this? Round the result to the to 2 decimal places, please. Okay. So show me how you're going to do this. Show me how you're going to do this. And typically, I will say that if you're taking a nurse entrance exam, or if you're taking any exam, you are allowed to use a calculator. Okay. You are allowed to use a calculator. So if we can just remember our conversion factors and our formulas, the calculator will do the real work. Okay. What do we say? 1, 2, 3, or 4? All right. Correct answer is going to be POW, number 1 again. Number 1 again. All right. How are we feeling about, and this is all we covered tonight, how are we feeling about our rounding rules for tablets, for decimals, and for weights? Are we feeling good about those principles? Can you explain them to somebody if you were asked? That is how you know you have learned something. Can you explain it? Okay, we're going to take it step by step. We'll take it step by step. So what we're about to do now is we need to also consider all of what we do as nurses. So we're going to get into, I want to switch your minds just a little bit from math and look at a big picture thing. Because what I don't want you to do, and this is something that I tell my nursing students all the time, I don't want you to get focused on just one aspect of your nursing care. I want you to always be able to see the big picture. So we're going to go back into the V2, and I want to watch one more video with you. It is the principle of assignment and delegation. Assignment and delegation. And like, again, this class will pick up tomorrow at the same time. We will get more into this. Okay, we will get more into this. But let's do the video, and then we'll come back and we'll do some questions. Okay, come back and we'll do some questions. So I'm going back into the V2, and I am looking for assignment and delegation. Now, assignment and delegation is a fundamental principle. So it is something that you learn right in the beginning of it. Now, this video is going to allow you to have a lot. If you don't have the workbook, take out notes, because this is going to give you some information. People pay me thousands of dollars to come in and teach this information, like literally $3,000, $4,000 to come in and talk about assignment and delegation. And I have it in the V2 for you right now. You're going to get it for free. So get this information. Take advantage of it. Assignment and delegation. Let's talk about this. This is a monumental task that you will do as a nurse every single shift. So, starting with assignment, what is it? It is the distribution of work or task among healthcare team members for which they are already authorized and trained to perform. In other words, when you assign something, it is essentially a person doing a task that they already know how to do. They're able to do it totally by themselves, independently, and they will do it right. On the other hand, okay, you need to understand not only is the person doing it right, but they're able to have a full accountability for it. So a nurse can assign a task to another nurse. Now, the question is, when that nurse assigns a task, who takes responsibility for that task? Well, the answer is the nurse who now takes over that task. So if you are a nurse and I give you something that you have been trained to do, when I give you that task, my hands are off of it. I no longer have to document. I no longer have to follow up with you to make sure it's done. You were assigned the task. Now, delegation, on the other hand, is the process of transferring a task to another healthcare team member while retaining accountability for the outcome. So if I tell my nurse's aide to go do Mrs. Jones' blood pressure, and 2 hours later, it comes up that Mrs. Jones' blood pressure was never taken, whose responsibility is it? Is it the nurse's aide or is it mine as the nurse? It's mine as the nurse. And that's the difference between assignment and delegation. So we have to be very careful when we are delegating tasks, but it's still a big part of us providing care. Supervision is just what it sounds like. It's the process of directing, monitoring, and evaluating the performance of a task by another team member. So you're looking at what somebody else is doing and you're determining whether it is satisfactory or not satisfactory. So delegation is one of the most challenging things to understand because there are many factors that you have to consider when you want to delegate appropriately. So, what are those factors? Let's talk about it. The predictability of the outcome, the potential for harm, the complexity of care as well. These are things you really want to think about. So I asked this question. I'm going to ask it again because this is a major point. When the nurse delegates to the nurse's aide, who is responsible for the task? I hear you saying, yes, it is the nurse. It is the nurse. Okay. And so we're making sure that the people that we are choosing to delegate to, the delegatee, has certain qualities. They need to have education, training, and experience. They also need to have a knowledge and the skill to perform the task. We know about the levels of critical thinking, and so they need to have a certain level of critical thinking to complete the task. And they need to be able to communicate with others as it pertains to the task. We're looking for a demonstration of competence. Also, we can't forget the facilities, policies, and procedures. If there is any licensing legislation, we need to know about it because Nurse State Practice Acts make a difference in who can do what. Let's get into the 5 rights of delegation. They are the right task, the right circumstance, the right person, the right communication and direction, as well as the right supervision and evaluation. And these just make sure that the person who is performing any act is put in the best environment to keep our patients what? Safe. Everything is about safety. So you want to make sure you have these 5 rights down. I'm giving it to the right person. This is the right circumstance. This is the right task for that person. We have established right communication. And then I'm providing the right supervision and the right evaluation. So, those are things that you now know that will help you to be able to answer not only questions for your exams, but also just be able to speak intelligently about it because you have to be able to communicate with your peer group, with the other interprofessional health team. So let's get a little bit into detail about who does what. What does the RN do? What should the LPN be doing? And what is the nurse's aide's responsibility? So this is understanding assignment. When we talk about the registered nurse is responsible for essentially the overall coordination of patient care. They're accountable for assessing patients, developing care plans, administering medications, performing complex procedures, and even educating patients. These are the things that the nurse is going to do. Now, the registered nurse, they can delegate certain tasks to the licensed practical nurse
and the certified nurses aides. But when they do that, they still remain responsible for the outcomes of the care. So again, if the registered nurse gives the LPN something to do, right? If they delegate to the LPN still has to do the task, but the RN remains responsible for the outcome. If the registered nurse delegates to the CNA is supposed to do the task, but that RN is still responsible. All right. So again, what do RNs do? They perform patient assessments. They develop and update care plans. They give the IV medications. So administering IV medications, they restrain for safety. So for NCLEX, for your exit exams, we don't have the LPNs restraining and we don't have the nurses aid restraining patients. And I know you could be like, but that's not how it is in the real world. I know, but while we're in the book, we got to work by the book. And right now we are in these books. The RNs also provide patient education and discharge planning, and they delegate tasks, LPNs, CNAs, okay? They make critical decisions regarding patient care, and they monitor the patient's responses to treatment and adjust care plans as needed. Yeah, RNs do a lot, but you know who else does a lot? The LPNs. The LPNs work under the supervision of the RN or even the physician, depending on the setting, and they are providing basic nursing care. Their role is typically focused on performing we call them the routine procedures. Okay. That means they are predictable. They're also monitoring stable patients. So when we talk about what can LPNs or LVNs do, in California, they're called LVNs. So what do? They also administer medications. Okay. Usually it is a PO medication, all right, or a topical medication. I can't even say just topical. It could be subcutaneous. Typically, the RNs do IVs. The PNs can do anything else. They provide basic wound care like dressing changes. The PNs monitor vital signs. PNs also teach. So don't think that practical nurses are exempt from teaching. You do teach. It's called reinforcement teaching or follow-up teaching. So after the RN does the initial teaching, the practical nurse will do follow-up teaching. And patients need a lot of follow-up teaching. PNs can also they can assist with implementation of the patient's care plan. Yeah. So the tricky thing here is that LPNs can be assigned to, or they can be delegated to. It's interesting. There are some things that the LPN can be totally responsible for, and then there's other things that require a delegation. And the LPNs even have the ability to delegate to the CNAs. So these questions can be kind of tricky as opposed to maybe what the RN does or the aide does, because the LPN, they can go both ways. Now, let's talk about that certified nursing assistant, the CNAs. The CNAs provide essential support by helping patients with their basic needs. Notice, I did not say nursing care. So they work under the supervision of RNs and LPNs, and they are crucial for maintaining patient comfort and safety. If you have ever worked with the CNA before, you know how much they support the nurses. Maybe you yourself are even one, and you know that really what you do helps keep that unit running smoothly. So what do CNAs do? They assist with the ADLs. The ADLs are the activities of daily living. So the bathing,
the dressing, feeding, toileting. They help with ambulation and repositioning of patients. CNAs can take basic vital signs on stable patients. They report intake and output. They observe and report changes to a patient's condition as well, to the RN or LPN. Okay, now that you know assignment and delegation and what each nursing professional does, let's do some practice questions. Here's question number 1. The RN is reviewing tasks for the CNA. Which task should the RN avoid assigning to the CNA? Okay. Number 1, feeding a patient who needs assistance. 2, taking vital signs on a stable patient. 3, ambulating a patient with a walker. Or 4, administering an enema to a patient with severe abdominal pain. What do you think? Correct answer is absolutely number 4, administering an enema. That's a treatment. We wouldn't have our CNAs doing that. All the other ones are okay. Let's try another question. Which of the following tasks should the RN delegate to an LPN? Number 1, developing a care plan for a patient with diabetes. 2, performing a head-to-toe assessment on a newly admitted patient. 3, administering a subcutaneous insulin injection to a stable patient. Or 4, initiating a blood transfusion for a patient. So here we are looking for tasks that the RN should develop and delegate for the LPN to do. The correct answer, I don't know if you picked it. Did you pick it? It is going to be number 3. Number 3. And because remember, the LPN, we're going to give the LPN the most stable patient that does not require any ongoing assessment or having any new changes, new things going on. So if we look at the other options, let's just talk about why they are not appropriate for the LPN. Okay. So number 1 says developing a care plan for a patient. So we're not going to have the LPN do that. That is something that the RN would do. Okay. 2 says performing a head-to-toe assessment. Now, do LPNs assess patients? No, not really. We're going to leave the assessment for the RN. And especially because what type of patient is this? This is a new patient. This is a new patient. So we want new patients to go to the RNs in this situation. And then 4 is initiating a blood transfusion. Now, this is something that the RN should do because this patient needs a lot of what? Assessment before that blood transfusion is started. So number 3 is the right answer. Okay, I got one more. Here it is. The RN delegates vital sign monitoring to a CNA. Which of the following patients is appropriate for that CNA to monitor? Number 1, a patient with a new onset of chest pain. 2, a patient who is 3 days post-operative from a knee surgery. 3, a patient who is receiving a blood transfusion. Or 4, a patient who is experiencing shortness of breath. What do you say? I hope you said number 2. Number 2, a patient who is 3 days post-operative from a knee surgery. This is actually the most stable patient. Okay. Number 1 has what? New onset chest pain. 3 is unstable because they're in the middle of a blood transfusion. And 4 is having a complication, an abnormal assessment. They have shortness of breath. So
we would need someone with a license to take care of these other 3. Number 2, the patient who is 3 days post-op a knee surgery is the perfect patient for the CNA. Okay, great job discussing assignment and delegation. I know now you can answer any question that you get because we have gone over the content. So I'll see you at our next study session.
Okay. So the biggest challenge that I have found is that nursing students tell me all the time, we have to know so much in nursing school and we end up cramming, and I don't connect with PowerPoints, and those are the typical experiences nursing students have. So I decided to create the Nursing School V2 for those who wanted a different approach to learning. So struggle no more, especially if you're an audio visual learner. You're going to learn quicker from somebody explaining it to you than reading a paragraph. And I want you to see during our short time together is that nursing is not about memorization. It's really about understanding. It's really about understanding. And so the Nursing School V2 looks different from the NCLEX V2 because I have to break it down into smaller pieces for nursing students. So tomorrow, let me go back to nursing school. In the Nursing School V2, just really quickly, the presentation that you see again is broken down into literal steps. Okay, so growth and development, then infants, and then toddlers, and then school age children. And when you're preparing for NCLEX, we kind of learn them all together. So the approach is very different for a nursing student. Now, somebody said, didn't watch the video, I got all of them right. That's good for math. That's really good. Thank you. I'm in med surg and I'm grasping the breakdown. Yeah, you have to break it down into smaller digestible portions. The video is so different from NCLEX V2. Yes, and that is because the audience is different. The audience is much different. So really quickly, let me show you. If you need the Nursing School V2, you don't have it, let me show you where to get it at really quickly, all right? If you go to my website right here, remarnurse.com, when you get to it, you will see the V2s. You'll see the V2 for NCLEX RN, that's not you. The V2 for NCLEX PN, that's not you. The V2 for nursing school, that's you, okay? So you would just click on the V2 for nursing school. And because this is a program that includes fundamentals, pharmacology, and clinical math, okay, we are doing the introductory price of the V2, and that is $39 for 3 months. If you want to go through the videos just really quickly, catch up, or if you're doing the year-long subscription where you will get all of the new information and all of the new courses, then you can do the introductory price of not $200, but $99 is where we have it. So this is perfect for those of you who don't want to struggle through nursing school. And then, as always, these videos are complimentary to Quick Facts for Nursing School. So that is the approach that I'm taking to educate nursing students all over the world. I'll do a quick question and answer session for you who just have quick questions about what we are doing for the next couple of days, anything about Nursing School V2, anything. All right, this is great. Good questions here. Nene says, which do you recommend for nursing students who are in their last semester, Nursing V2 or NCLEX V2? This is a great question. You have already completed most of nursing school. So anyone in their last semester of nursing school, you're preparing for your exit exams, and you would need to take the NCLEX V2 for that, because that's going to cover all of those safety points for your exit exams. Miss Regina, can you repeat when you do study and review sessions on YouTube? Absolutely. I go live on Monday at 12 p.m. Eastern time, and then I go live on Wednesday at 9 p.m. Eastern time. So convert your time zones and set your alarms. Okay, or subscribe to the channel, subscribe to the YouTube channel. And that is a way for me to know who's watching, who's interested, and what I need to do more of. So take a second and subscribe to the YouTube channel. Wish I had nursing school V2 when I was going through nursing school. So do I. I wish I had this resource when I was going through my nursing school, because I did not necessarily have a study group that I hung out with. And this would have helped me to get way better grades. And I probably would not have had test anxiety in nursing school if somebody broke down the fundamentals to me and I just would have so much better. All right. How do I pass fundamentals of nursing? I think the best way to pass the fundamentals of nursing is actually master the concepts and fundamentals of nursing. The challenge of fundamentals is that it is not isolated to one area of nursing. That is the challenge. And usually it's the first class that you get. Okay. It's the first class that you get. So if I show you the fundamentals section here, you literally have what we just watched: assignment, delegation, admissions, discharge, and transfers. That's a fundamental. Subject, ethical and legal responsibilities. Fundamental. I have 3 sections of fundamentals, 4 sections of fundamentals actually, because you still even have to know anatomy and physiology and fundamentals. So I would say if you don't have this course, just get into it. Get into it. My videos are not long. This video is 8 minutes. All right. This video is 11 minutes. This video is 9 minutes. And so being able to I call it fast pass, those subjects are going to be extremely helpful. What is it? So I can share. Okay, hold on one second. Okay, so much stuff. So many good questions. These questions are detailed too. Wow. All right. So you're saying if I get the V2 for nursing, this is in addition to what I will need to use as secondary to my schoolwork. Absolutely. I did a video called Why Some Nursing Students Do Better Than Others. Right. And one of the points that I made is that there are nursing students who are actually studying before the class. Now, they won't tell you that. They won't tell their peers that, but they are prepping before the class starts. So, for example, if you know you're going into fundamentals, you can look at your course syllabus and see, okay, we're about to do the section on legal issues in nursing. Okay. How about before you go to that class, you watch the legal issues of nursing. And so when you're sitting there listening to your teacher, you have a framework to put what she's saying in. And it's not all new to you and it's not all foreign to you. You're already prepared for success. I tell that to my kids all the time. The preparation that you do leads to success. And people who do things very well, it's because they've practiced it. It's not just because they're better at it than you. They're practicing. All right. Okay. I failed my NCLEX and realized I am lacking more. I use NCLEX V2. Should I get nursing school V2? So that's a great question. The thing about the NCLEX review is that it is supposed to just be that. It is supposed to be a review of concepts you've already learned and understand. However, if you find that a lot of the information is new or you may not have learned it, then absolutely you need something more in depth. All right. So I would say yes to that, but you know where you are more so than me. Okay. Okay, thank you. I start accelerated BSN next week. Wow. Okay. Then you know even more so with an accelerated program, you're going to have less time before you have some sort of assessment on the information. So you got to go. Lee says, do you recommend the nursing school V2 if a person has been out of school more than 15 years, or NCLEX V2, or both? Okay, so here's the thing. If you have a track to take the NCLEX, you need to be, sorry, that's my alarm. It's time for me to go. Okay, so if you are preparing for the NCLEX, you need an NCLEX prep program. Okay, that's number one. So you absolutely have to do the NCLEX review because you're going to get quick facts for NCLEX and you're going to get the lectures for NCLEX. The mentality for nursing school is totally different. Okay, it's totally different. So I would say I would focus you in on the NCLEX for sure, and then just use this as a supplement to maybe something that you want to brush up on, but the NCLEX should be your focus. Okay. Yes, you missed the calculation part. I'm sorry. We did that early on. This class started at 8 p.m. and we started on time. I start LPN clinicals this week and I needed this. Perfect timing. Perfect timing. I failed my first CAT exam. That's all right, because you know what? The CAT exam is supposed to be, it's supposed to be a practice run of the NCLEX. So you get another one. What you need to focus on is during that CAT exam, did I second guess myself? That CAT exam was up to 5 hours. I don't know how long yours was, but were you able to sit and focus for those 5 hours? Okay. Those are things that you're doing. You're just brushing up your discipline, your ability to concentrate, not second guess yourself during that CAT exam. Take your first one. Okay. We have to pass a dosage calculation test to move forward. In nursing school, okay, let me know if that's the case. The difference about the V2 for nursing school is unlike the V2 NCLEX, all of these are open. And the V2 for nursing school actually does come with a question bank. So after you do the subjects, there's 1,300 questions in here for you to practice. And I think this is also going to be so helpful for you too, because you have your clinical math, your fundamentals, med surg questions, pharmacology questions. Let me just do a test. So you can create your own test, whether you want to do a tutored test, and you can pick your subjects. It's kind of it's a dynamic testing. So you can actually pick the subjects that you want to do in here. And in your spare time, go ahead and do practice questions. So really it's everything. It has everything that you need to get focused. You can just go through the questions as well. Okay. So like I said, it's a really comprehensive program. I began clinicals last week and I've already done the V2 NCLEX review, V2 nursing up next. Thanks for everything. Okay, you're just covering all your bases. One of the things about the V2 for NCLEX is you can do that in 30 days. Like you can, the NCLEX prep, it can be very fast. So that's cool. My orientation said we have to get 100% dosage calculation in order to move forward. Nursing school. You can do it. You can do it. They're going to be the same formulas that we went over today. So don't sweat it. Do not sweat it. You're going to be prepared. You're going to do what you have to do to get that 100%. You know, sometimes nursing schools do things to weed out people. And I think having to get 100% is their standard. So is their standard. I'm still finding my way around V2 though. Not sure if she has case studies. I do have case studies in the NCLEX V2 in the question bank. There should be a section that actually says in the NCLEX V2 that says, bang. Is the 5-hour NCLEX review still valid from 5 years ago? Let me know what you mean by that. Yeah, that's going to be standard. But it's still considered the new generation or next generation NCLEX. All right, thank you so much. I'm taking NCLEX soon. If you're taking NCLEX soon, go ahead and get in the NCLEX review for the V2. V2 NCLEX review is going to be for those who are senior in their nursing program, final year, and you need to review to get out of nursing school, your exit exams, and get your nursing license. That's going to be the one for you. If you're new to nursing school, you're about to enter nursing school, or you're fresh into nursing school, the nursing school V2. And that's why it's a year-long course. You have the option for the entire year. Well, the reason why they have these markers is because nursing schools don't want you to continue on if you're not going to be successful in the program overall. And so that's why they have the TEAS test, because somebody who can't understand English or read for comprehension, not going to be successful in nursing school where we have to read 9 chapters a week, right? Or they don't want you to fail the NCLEX So they won't allow you to finish in a way. All right. Okay. Do I need to get NCLEX V2 if I have quick facts already? Yes. And let me just tell you that, especially if we're talking about this one comes with no lectures, and it is part of a course, a full course. So this quick facts is med surg and pharmacology. What we did in the V2 was fundamentals, not in here. No fundamentals in here. No clinical math in here. No pharmacology. Well, pharmacology is in here, but these are videos that explain it. I have mental health that I'm recording. I'm putting it in the V2, not in here. So if you want full support, you get both. Okay. All right. Okay. All right. So all these questions, also, guys, please, you can email me, support@remarreview.com, for those that want to have more detailed advice from me. I'd love to read it as well. So many scenarios here that are good. But in general, if you are just beginning your nursing school, maybe you're in fundamentals now, or you just got fundamentals, then you're going to get the nursing school course. I'm going to be building it out over the course of 2025. So like I said, I'm recording the mental health videos now. Then I'll probably break into, people are requesting me to do maternity, pediatrics. But also, let me say this too. There is another section in the courses that I haven't talked about. Let me leave this. There's another section in here, which is the anatomy and physiology section. And this is actually the first thing that you come to. And so what you're going to do is you'll go through anatomy and physiology here, and it's going to be a very good prep for you to be able to go into pharmacology. All right. And all of these have actually a workbook. So when you go into a file vault, workbooks are so important to me because they help you learn quicker. You'll go into the workbook, and you will either get the Fast Pass workbook, or you'll get the AMP, Anatomy Physiology workbook. And you're just going to download it. Click the download button. This is blue arrow here. Let me see if I can click it. If I didn't click it too many times, it'll pop up. I know it's taking me a long time. There we go. And then you can get it and you can print it out. Okay. And while you're watching those lecture videos, you can go ahead and take notes on all the different sections. All right. You can go ahead and take notes on all the different sections. So that's part of the experience here, which is something that, for those of you who are interested in, now why is it highlighted? There we go. For those of you who are interested in taking it to the next level, like I said, taking it to the next level. All right. So you know what, for me, it doesn't matter. We've had nursing students who've been out of school for a long time, 10 plus years. And when they get the right information in front of them and they're able to study it in a systematic way, okay, they're able to master the information. Like I said, when you know it, then you can explain it. You can answer any types of questions about it, and you don't have the same fear of it. So I hope we did that today with math, and I hope that you understand assignment and delegation and who is supposed to do what now, right? And it only took you about 20 minutes or so. So tonight we're focusing on the nursing school V2, all right? The nursing school V2 for nursing students, okay? Crafty said, what's the difference between the Fast Pass and the AMP? Yeah, you should, you graduate in May 2026. Should I get nursing school V2? Yes, you should get nursing school V2. Should I do this before getting into nursing school? You can. It would definitely give you a foundation. And if you think about nursing school is very expensive. You can take this $39 course to even see if this is something that you really want to do, because you're going to be learning these exact same things. You're going to have to learn about the body and urinary elimination and bowel elimination. Is this something that you really want to do? Okay. Let me get back to this one. What's the difference between the FastPass and the A&P workbook? It's literally just the location. So you're going to get a workbook when you're in the FastPass. You need a workbook for all of these, okay? And then when you're in anatomy and physiology, you're going to get a workbook for these subjects, okay? So that's just the difference. But that's all included in the nursing school V2. Okay. All right, everyone. Thank you so much for coming to this class. I'm going to close this class out. I said I was going to have it in under an hour, and we have been here for more than that. So how about we join each other tomorrow night? We'll be doing liquid dosage calculation. So tomorrow we will be doing that. If this is your first time here at Remar Review, I hope you see the difference in how we prepare, the difference in what we are challenging you to do. It is much more than just passing a test. It is literally about you becoming a safe nurse. It's about you becoming a safe nurse because you have competency, because you have an understanding of how you're going to administer nice, perfect, confident care to all of your patients. Nursing is a ministry. And so the knowledge that you have will separate you from the rest of the population. So tomorrow we will join together at 8 p.m. Eastern time. God bless you all. Have a good evening. Don't forget your workbook, okay? Don't forget, bring your workbook tomorrow because sometimes it is more challenging to keep up when you don't have the workbook. So tomorrow night, bring your workbook because we'll be doing liquid dosage calculations and we're going to go and do another lecture into the V2. So I hope you enjoyed this free class. It was put on by the entire Remar team for you, just for you. So it was a lot of effort to get you here. And I'm so glad that you made the sacrifice to show up. So I will see you tomorrow. We're going to do the lecture for liquid dosage calculations. And then don't forget on Wednesday at 9 p.m. One more thing. Wednesday at 9 p.m. we're going to do a Kahoot game night, which is also going to be really cool. So I'll talk about the rules for Kahoot later on. But I will see you tomorrow. Bye-bye.